Hello, I'm Dr. Hussain. We're going to talk about normal values again. We had a part 1 where we discussed certain aspects of normal values, and I was trying to question why we use the normal values that we do. We discussed blood sugar levels, we discussed thyroid stimulating hormone TSH and testosterone level in men. And in this video we are going to look into how do we establish normal values, what are the criteria. So this is part 2. My blood sugar, my blood tests are normal, but I feel like crap. So of course this is for education purpose only. If you have any medical condition, you need to see a healthcare professional, and you should not be acting on anything you learn from this video. So how are normal values established? Well, there can be different criteria for that. It can be the absence of a symptom, absence of a disease, absence of a condition, where we say that if you have this range in your blood test, then you are unlikely to develop this or that condition. So that could be one way of doing it, and it's being used, for instance, in the case of vitamin D. We'll discuss that in more detail later. And also in the case of ferritin, which is the storage of iron in our body. There's also another way of looking at it, is the 95% mantra, where we have 95% of the population. We'll discuss that in a separate video, where we can then define the 95% of the population to be the normal ranges and say if you lie within that, we are happy with your blood test results. There can be other criteria also, of course. But in this video, we're going to talk about the absence of a symptom, disease condition, and we'll look at vitamin D and ferritin. And in the next video, we are going to talk about the 95% mantra. Okay, so let's start out with vitamin D. The criteria for vitamin D was established maybe 100 plus years ago, where it was observed that in certain societies, children living in urban societies or communities had a tendency to develop rickets, have unhealthy bones. At that time, it was discovered that vitamin D levels below 39 grams per milliliter increased the likelihood of developing unhealthy bones, and that was then the lower limit for vitamin D. For ferritin, it's the absence of anemia is often used as a criteria, or looking at anemia parameters. So let's start out with vitamin D. As I said, more than 100 years ago, it was found that children living in urban societies that were not exposed to sunlight, they had an issue with their bones, and with vitamin D levels above 39 grams per milliliter, their bones were healthier and less likely to be diseased or having problems or developing rickets. So at that time, and since then, we are using that lower limit for vitamin D, 39 grams per milliliter. If you're above that, you're fine. But we know now, over the past 100 years, we have done so many studies, we have realized that vitamin D has so many more functions than just our bones. And every single cell in our body actually can act on vitamin D. And every single cell in our body has vitamin D receptors. Vitamin D is important for our immune system, and it's very important for our immune system. If we want a healthy immune system that is able to take care of safeguarding the health of the body, well, in that case, we need sufficient amount of vitamin D. Vitamin D is also important for calcium uptake. If you're vitamin D deficient, it's more likely you will not be absorbing the calcium you need from your intestine. Magnesium metabolism, vitamin D is involved in that. It's involved with parathyroid hormone. It's a precursor for steroid hormones also. Vitamin D is not just a vitamin, it's actually a hormone precursor. Vitamin D deficiency can lead to insulin resistance. Insulin resistance, if it develops any further, it can lead to type 2 diabetes, and essentially type 2 diabetes is just insulin resistance with a more advanced development. We know that vitamin D can affect many hormones, and we also know that vitamin D is important for our mental health. And this is not a complete list. There's so many more functions of vitamin D that we haven't taken into account. I just want to actually show you that having a criteria of rickets or healthy bones is not really sufficient if we want to understand what importance vitamin D has. Of course, we also need to look at toxicity. If you're taking too much vitamin D, can it cause any issues? And it can potentially cause you to develop high levels of calcium in the blood, which we don't want because it can lead to a number of issues. Now, generally speaking, I know this is not about the normal values, but I usually put my patients on pretty high doses of vitamin D that is supported by medical science and medical studies. Often 5,000, 10,000, and in some cases 15 and 20,000 units of vitamin D on a daily basis. It's very important, if you're taking vitamin D, you have to make sure you are taking sufficient amount of magnesium, and you also need to make sure you're taking vitamin K2, MK4, or vitamin K2, MK7 to ensure that the calcium is not deposited in your soft tissue, it goes to your bones and your teeth. Anyway, that's a detour. Anyway, so vitamin D has many more roles to play than just being important for your bones. So rickets should not be the only criteria for normal ranges if we want to discuss vitamin D or optimal ranges. Vitamin D has so many more responsibilities to look after than just bone health. And all functions of vitamin D should be considered for us to establish an optimal level. There are studies that show 60 to 80 nanograms per milliliter is more appropriate, maybe, if we consider all the other functions of vitamin D. And there are even studies where patients should be maybe at 60 to 100 nanograms per milliliter. If you're having vitamin D resistance, just like you can have insulin resistance, in some patients, in some autoimmune patients, you might even want to have vitamin D levels that are much, much, much higher than this. So, but anyhow, for most patients, 60 to 80 or maybe 60 to 100 would be a more optimal range for their vitamin D levels, considering all the other important functions that vitamin D has beyond bone health. And again, in some patients, we might even want to go beyond that. Let's talk about iron deficiency. If you look at the numbers, the reference ranges or the normal ranges for iron in the blood, you will see there's a huge gap between the lower and the higher number. If we want to see what the iron status is in a patient, we look at ferritin. Of course, we can also run a complete iron profile, which is often a good idea, but ferritin gives us an idea about the storage of iron in your body. Now, it can also be raised due to acute inflammation, so sometimes you can't just trust ferritin as a parameter for your iron status. Anyhow, it is a good test. But the interesting part here is that some labs would say 11 to 300 or 307 nanograms per milliliter is the range for normal ferritin levels. Some labs will say maybe 12 to 150, and some labs will say 10 to 120. Now, looking at this is a 30x difference between the lower limit and the higher limit. That's pretty huge. Does this really cover the same kind of health for people, whether you are 10, 11, 12 or you're 300? Is that really the same? Could it be that we have a too wide range for ferritin and we need to adjust that? Now, the next question is then, what are the criteria for ferritin to be within normal ranges? Well, if we look at it, it's something about anemia. If your iron level is fine, if your ferritin is fine, if you do not have anemia, that is often the criteria for us to say that your ferritin levels are fine. And for that purpose, maybe yes, maybe 10, 12, 15 nanograms per milliliter is sufficient. Some studies and some researchers may use transferrin saturation as a parameter for having sufficiency in ferritin. And but we do know that despite of that, if we have women with symptoms of iron deficiency lying within that range, having symptoms of iron deficiency within the normal range, what do we do with those patients? How should we deal with that? Should we just say, well, you're within normal ranges and we don't really care for doing something about it, simply because you are in the normal ranges. But ferritin does not just play a role for anemia or red blood cell production. Ferritin is a far more important micronutrient than just our anemia status. Actually, anemia is probably one of the last things to develop in cases of iron deficiency. The body is pretty smart. If it sees it's lacking in iron, it's not going to reduce the production of red blood cells or hemoglobin or anything as the first thing, because it knows it's so essential for the functioning of the rest of the body. So anemia is not the first thing to go, it's actually one of the last things to go. So waiting for anemia to develop before we talk about iron deficiency is simply not okay. It's kind of ridiculous. We know that iron is important for hair, and I work with the hair patients, and I've been doing that for the past 18 years. I want my patients to have a ferritin level of more than 70 nanograms per milliliter before I expect their hair to be healthy enough if they're suffering from hair loss. We also know that the thyroid requires iron to produce thyroid hormones. And I've treated patients with hypothyroidism just by giving them maybe a combination of iron and selenium, with no other medication, no thyroid hormone substitution or anything, just by giving the patient sufficient amount of iron and giving the patient sufficient amount of, for instance, selenium or zinc. I've been able to do away with their hypothyroidism. No prescription medicine, just supplements, or maybe changing their diet, or maybe looking into their gut. Everything is pretty connected. We also know that iron is important as a cofactor for DNA replication. We know it's important for bone health, it's important for muscles. Why don't we consider the immune cells? Why don't we consider all the other many roles that iron play in our body? Why do we focus on anemia, which is again one of the last things to develop if you have iron deficiency? So if we want to have normal or optimal values for iron, we have to consider all the roles that it plays in our body. It's not enough to look at anemia. And there are some studies that indicate we should be at maybe 70 to 135 nanograms per milliliter for sufficiency in iron. And there are even some studies that say we should maybe be even higher than that. Maybe we should be at up to 150 nanograms per milliliter. But anyhow, the present ranges do not make any sense at all. It doesn't make any sense that we use anemia as a criteria for iron sufficiency, as we know there are so many more important functions that iron has, just like vitamin D. So if your tests are normal and you're feeling like crap, it could actually just be because the criteria for being normal are not right. And as healthcare professionals, it's very important we are critical about how we communicate to our patients. And it's also important for the patients to understand that maybe, it may also not be, but maybe if you do not feel well, if you're tired, if you develop acne, if you can't sleep well, if you are exhausted, your sex drive is down, maybe you're gaining weight, maybe you don't have the vitality you used to have, maybe your mental focus is not fine, maybe you get tired very early, very easily, and maybe there is actually something wrong. And maybe the criteria for you being healthy is simply not right. And unfortunately, as healthcare professionals, we tend to be very focused on blood test normal values that do not actually reflect health. If you want to look into more depth about this health versus disease, then do watch the part 1 video about normal values. It's titled the same thing, my tests are normal, but I feel like crap, and that's part 1. Thank you for watching this video. You will probably have someone amongst your families or your friends that have been to the doctors, that got normal blood tests, and they've been told we do not find anything. It could be in your mind. Maybe you should not be so focused about something could be wrong. Maybe you should just try to enjoy life and not focusing on disease or your health, because you seem to be fine anyway. So if you have people amongst your family and your friends, do share this video with them. It might give them some relief to know that there could be a reason why they're feeling the way they're feeling, and they can have a discussion with their healthcare professional about what to do in their situation. So share this video with your friends and family, like it and subscribe to our channel. Thank you for watching, and I'll see you at part 3. Thank you.